Hello, everyone. My name is Michael Broby, and I am the Africa National Regional Coordinator for ISSUP. ISSUP is a membership organization focused on substance use, treatment, prevention, and recovery. And we welcome you all to our first ISSUP Uganda webinar. And we're very excited to hold this webinar. And as we are having this webinar on our platform, GoToWebinar, there are a few things to bring to your attention. First and foremost, during the webinar, you will not be able to unmute your microphone or be able to put your camera on. But during the webinar, we have a chat function where you'll be able to put in your questions, which will be collected at the end and will be shared with Giovanna. She's doing her presentation for her to answer these questions at the end of the webinar. Once again, I welcome all of you to this exciting first ISSUP Uganda webinar, and I'll now hand over the time to my colleague, Rogers, who's the ISSUP president for ISSUP Uganda, and he will do an introduction, and then we'll carry on with the webinar. So, Rogers, I'll hand over the time now to you.
Thank you so much, Michael. I'm really excited today because I'm carrying so many quotes with me. Today, I'm coming to you as the interim president of ISSUP Uganda. But I also work with the Uganda Youth Development Link, an NGO which is organizing this webinar. I'm also excited that ISSUP Secretariat can organize for us this webinar meeting. And I think this is following some of the webinars we've had. We've had the one to do with the African Union, who organized a meeting, but also Kenya has been organizing, ISSUP Kenya and Nigeria. Giovanna, we are happy to see you. I know we met last in March, before the COVID-19. And thank you so much for the work you do in the area of treatment, in the area of prevention. I'm also excited about the new laws you are praying at UNODC, United Nations Office on Drug and Crime, to help disseminate, pass on good tools, pass on good practices, so that member countries, NGOs, and individuals can prevent substance abuse among young people. And substance abuse in Africa, in a low-resource country, is part of the many wider problems we have in Africa in low-resource setting. And the low-resource setting is very challenging. We want to hear from you that if you are living in areas where they have low resources, and you have adolescents, you have young people, you have families, how do you intervene? How do you come in? There was no other person to look at except you to help us, give us an overview in a generic way. How can we intervene? Also help us, if you know some resources at UNODC, can you help my members to get some of these resources, to know where they can access them? And also, what other ways can we help families? Giovanna, I want to tell you, we are not allowed to meet as groups. We used to bring children together, have 300 young people, but now it's not possible. Most of the interventions can happen in families, in households. What can we do? I don't want to take a lot of time. I think this is devoted to you. We appreciate. Send our greetings to other people in the UNODC family in Vienna. Our heart with them. Please, I want to invite you to take over. Thank you very much.
Thank you. Thank you, dear friends. Thank you for the kind words, and thank you for having me to speak about one of my favorite topics, which is not only evidence-based prevention, but prevention with families, right? And so if you give me 1 second, I try to share my screen. Olivia, can you help me? You had done it before.
We can see your screen now. We can already see the presentation.
Thank you. Thank you so much. So here you go. And hopefully I will be able to answer some of the questions that Rogers has already raised in his introduction. I can tell you already, I don't have the answer to everything, but I can give some ideas, and hopefully we will see ISSUP Uganda lead the way with new innovation like you have done in the past, Rogers. I really count on you. But let me start with what we know, and then we can discuss together, you know, how to use this information. So family-based prevention. First of all, why it is important. Let's talk a little bit about that, so that we feel strong when we start thinking about preventing, working with families in prevention. You know that we have published the first in 2013 and 2018 the standards on prevention, and I mention this because this is where we have summarized science from all over the world, and we have listed the interventions that have been found effective in preventing drug use, substance abuse, and of course other risky behaviors as well. And this is the summary table, and you can see that we have interventions to all the ages, childhood, adolescence, adulthood, in all of the settings. And of course here we have all of the intervention on family. And if you look at this nice thing with glitter that my daughter likes so much, this is where parenting skills and family skills are. And this is the kind of program that is more commonly and more easily implemented in terms of family-based preventions. There are other here in infancy, but I want to talk about the low-hanging fruit, the easiest and more effective. There is a lot of research on these programs. First of all, there is a lot of research that indicates how parents matter. This is a graph that comes from a study from the US, and you can see that on the horizontal axis, the monitoring by parents, so parents being interested in knowing all of the activities of their children, and the probability of, on the vertical axis, the probability of using drugs, in this case, inhalants. And you can see that the more parental monitoring, the less probability there is. And you can also see 3 lines here, and this is an indication of parental warmth. So in the blue line, the style of parenting is not so warm, and parents need to find out what the children are doing. In the orange and yellow line, the style of parenting is so warm, and the bond between the children and the parents is so strong that the children trust their parents and tell them about what is going on in their lives. And as you can see, the probability is really the lowest. And it's really, really important, that combination between monitoring and the parental warmth, because look at what can happen in this graph. In this graph, you can see that high monitoring, which is the light line, but with not so high warmth, means higher higher probability of use. So monitoring is essential, but also love and parental warmth, a positive and warm way of being a parent, is also essential to prevent drug use. And so and of course, we can see in the research also the opposite, right? We can see that adverse childhood experiences are associated to higher rates of substance use in adolescence and adulthood. And of course, adverse childhood experiences include neglect and abuse in the family. And we can also see that those who pay the price are the people that are poorer. So individuals with many adverse childhood experiences, only 4% of them in the higher income group of individuals have substance abuse problems. But this percentage goes up 3 times in the case of people on lower income. So really we can see not only the importance of family, but how the relationship is with inequality. And this is where our programs come in, right? The Family and Parenting Skills Program. And these kind of programs really are programs that just help parents be better parents in very simple, happy ways, activities, no lectures, no psychosocial medical jargon. And really the aim is to develop that warm child rearing style and strengthen the parents and children bond that we have seen is the most important protective factor in the life of children. And it's good for children of elementary school age, like 7, 8, 9, 10, but also in early adolescence, like 11 to 14. And you can deliver it for all families, but also families in difficult circumstances. I want to give you some examples of the activities that we do in these programs. So, for example, there would be an activity to increase the attachment between parents and children, and the family, the parents, and the children will be asked. Think about things, 3 things that you can do together as a family. One thing that costs money, one thing that does not cost money, one thing that can be done inside, and one thing that can be done outside. And then the homework for the family is to do that one thing that week. Or there is an exercise about monitoring, and so we practice particularly with the parents, but then with the parents and the children together, that the parents ask those questions in a friendly, non-threatening way, but do ask, where are you going, who with, when are you coming back, and so on. And then, of course, we practice way of giving order and limits in the family, right? And what to do if things go wrong. Because typically what happens if there is a problem and the child does not obey, then the parents get very frustrated and angry, and his or her brain doesn't think very well. You know, when we are angry, we don't think very well. And so it's important, and then we say silly things like, that's it, you are grounded forever, which of course is a threat that cannot work, and therefore you lose credibility as a parent. And so it's important for the parent to practice to think about appropriate negative consequences. So for a small infraction, a small thing like withdrawal of a privilege, and for a bigger thing, of course, a bigger consequence. As I told you, simple, funny ways to improve the way the family functions. Or here, this is a program that we do with people in very difficult circumstances, like refugees, and where there is a lot of stress, or like now during the pandemic. And we do an exercise where parents and children learn separately what are the signs of stress, how to recognize stress in themselves and in the others, and then what to do about it. And then we bring them together and we draw on the floor the steps of stress from 0 to 10. And then the parents, the children ask the parents, in this situation, guess how stressed I am? And then the parents do the same to the children. And I can tell you, you might think that the parents are better at guessing the level of stress of their children, but it's not true. Very often, we have seen it is the children that are better, and it's the parents that need to learn. Huh? So these are the kind of activities that you do in this kind of programs. And you might be wondering, yeah, right, are they actually effective? Does anything change there? And we have a lot of evidence, and I want to show you some of it. This is the formal evidence from the standards. We had 5 reviews, systematic reviews of the evidence that looked at, hundreds of studies themselves. And we know that these programs can prevent substance use, including, and the effects persist in the medium term. The WHO has done a lot of work on the effectiveness of family skills program, and they recommend them to prevent child maltreatment, a very, very important risk factor, to promote the development of children that are very much at risk, including in cases of malnourishment or kids that are frequently ill, or in cases where mothers or parents are affected by mental health disorders, or in cases where the children have behavioral disorders. And finally, WHO recommends this program to prevent youth violence. So violence by youth, because they have found to be effective. And you might think, yeah, Giovanna, yeah, very interesting, but you know, all of these programs, they are for rich people. I want to show you that that is not the case, that in fact we have successfully implemented these programs in very difficult communities. I don't have the time to go in the detail of these graphs, but of course I can explain them to you. For now, just let me tell you how this graph, for example, shows to you that family skills training has been effective with families in very violent communities, and in particular in this case in Honduras, that you might know is one of the countries with the highest homicide rate in the world. Here we have used family skills training in various countries, including in Iran, with families of very poor communities with children in kindergarten, and we have been effective. Here we have used family skills training amongst refugees, Afghani refugees in Serbia, and we have seen improvement in the behavior of the family and of the children. Family skills training, by the way, is also one of the programs that is most consistently beneficial for both girls and boys, and this is not the case for all prevention. And here you have an example of how parenting skills are effective for girls in early adolescence, and here you have another example with Afghani refugees in Afghanistan, showing how the behavior of children, both girls and boys, improved as a consequence of our program. And here, as I was mentioning, is the formal reports of WHO that shows how these kind of programs are effective on violence prevention, particularly youth violence and child maltreatment. So I think you can see that there is a very serious body of evidence that this kind of activities that seem so simple and not sophisticated at all, in reality are very, very effective. We also have evidence that this kind of prevention is cost effective. I often quote this figure that for every $1 that we invest, we save at least 10. What I don't manage to say very often is that this calculation comes from the evaluation of a family skills prevention program. So there you have it. It's very specific. We also have this evidence from studies from all over the world, right? So, for example, we are now in 29 countries currently piloting family skills with UNODC only, and there are of course many others that are doing it on their own. This is only the ones that we are involved in and where we have evaluated effectiveness, and it has been successful. And I look at Africa, still a few countries there: Kenya, Ethiopia, Ivory Coast, Senegal, Tanzania. I don't see Uganda there. I hope I can add it very soon, right? So I think that when people ask me, are they effective? I can say yes, and you can say yes. And if somebody has doubts, call me and we will try and persuade him or her together, okay? Let me see how I'm doing with time. Halfway through, not too bad. Let me see. Okay, so let's say, okay, Giovanna, yeah, it's okay, but really all of these family skills are from America, and how can I apply them in my country? And I don't want to usually have an entire small session on this, but I have shown you our slide on how we have implemented successfully this all over the world. And I want you to be reassured that when we are talking about importing a program of family skills, I'm really talking about adapting the program very carefully to the sociocultural situation that you are working in. And we have an entire chapter on our guide on how to do this. And basically what to do is, this is a summary of the adaptation process that we can talk a bit more in detail if you're interested in. But in a nutshell, it's really about trying that dress first. So, you know, when you go to a shop, or unless you are getting your clothes, your dresses, and done to measure for yourself, and you buy a ready-made dress, what do? Do you change it before trying it? No, you try it first, you see how it fits, and then maybe you change it. And with the programs, is the same. You adapt them very minimally, but you try them as they are. And if they are working, good. And if they are not working, of course, then you start thinking about changing. And we have been doing this all over the place. We have been supporting beneficiaries, facilitators, trainers of facilitators, and it is working. This is another example from Central Asia. And so I think you can really be reassured that even importing a program that does not come from your country can be effective. And another thing that many people tell me is that, okay, maybe they are only from America, but they are so expensive. And I have to admit, you know, at the beginning, this was true. Many of the original programs were, and still are, the property of universities that were selling them, right? And it was not cheap. And that is why once we have had a few years of experience in developing these programs, we had said, well, okay, now is the time. It's the time to develop programs that are tailored to low resource settings, and they are in the public domain, available to all to be used. And so these are the two programs that now we are starting to use more and more. There are two. They are one for particularly difficult circumstances, the Strong Families programs. It is only 3 sessions, actually 2.5. And then there is a bit of a bigger programs for whole families, which is Family United, that is 4 or 5 sessions. So you see, very, very, very light. And as I said, in the public domain, available for all, not for profit, of course, but available to anybody who wants to use them. And I hope we will have a chance following this conversation to see how they can be used in your great country as well. Okay, so many, I would say, you know, some, I have been having some conversation, and people were saying to me, like Roger will say, okay, you've almost convinced me, but really, we need to think about this one after the pandemic. Now it's not possible. And that's where I would say, well, let us think together, okay? These are data from this report of Save the Children, Protect the Generation. They have done a survey among children all over in the entire world, 8,000 children. Of course, it cannot be completely representative. There are billions and billions of people all around the world, right? But it still was a good effort to be as comprehensive as possible. And look at the figures. They really, really show how during the pandemic, the rate of children reporting being nastily told off or abused in the family has gone up. And that is particularly the case in the case of families that have lost their income, where of course the parents are under enormous stress to provide for the family, and also in cases of when the schools were closed for the pandemic and children were compelled to be at home, often in crowded and stressful condition because of the pandemic, and the rates are really, really staggeringly high. And no, we cannot wait until after the pandemic. We need to start acting now. What we have done to start is not a complete answer, of course, but we have developed tools for parents that are available in all languages, and they are available on our website, again, free for everybody to take and print and use in whichever way. And we have a leaflet and a booklet, particularly the leaflet that is a concise list of tips for parents on how to take care of themselves and of their family during the COVID pandemic, has been translated in almost 40 languages by now. The booklet is more extensive. There is more discussion of the various tips, so it's been translated in less languages. And if you think this is who cares, this is just a leaflet, I remind you that we did an experiment together with the University of Manchester. We did an experiment in refugee camps in Turkey. They were Syrian refugees, and the experiment consisted in putting a leaflet written in Arabic in the bags of bread that all of the families were receiving. And with the leaflet, there was also a small questionnaire about the leaflet. And can you imagine, usually when you try to do a survey, you have a response rate of 10, 15%. This is considered good. 60% of those questionnaires were returned with the parents testifying how the tips in the booklet had, in the brochure, had helped them so much in dealing with the situation, and they wanted more. So even a leaflet sometimes is a good start. And we have a different leaflet that is particularly written for families in refugees camps or in very crowded communities. We have seen some difficult situation in slum areas where families are compelled to live in very, very cramped circumstances. And of course, some of the tips that we give for parents that have other kind of resources at disposal might not be relevant. And so we have developed a leaflet just for them. And there are, as you can see, tips on staying healthy and safe for the parents and the entire family. Also thinking about situation where water might be a problem, and then looking after oneself as a parent, and things, and making the parents think about what the child might be experiencing and how to help the children. So these are tools that we have developed, and of course, it does not mean that we have been able to disseminate them through our field offices, and I would be very, very happy in the discussion to think about it together, how we can take these resources and really help the families in your communities. Another thing that I want to conclude with, and it's a bit, because it's a bit happy, and maybe you can use it too, I would certainly encourage you to use these resources, is our Listen First campaign. We have just launched a campaign of 10 videos on different practices that can help parents, particularly in these difficult circumstances. All of these practices are science-based, and so, for example, there is a little video that is called The Science of Affection, and for each video there is a fact sheet with practical tips. So another way of of encouraging parents to change their way of parenting and to be as warm as possible also in these difficult circumstances. And there is a video on playing together, on active listening, and on family activities, and there will be 6 more video launched in 2021. And so I would like to invite you to follow us on Twitter, because this is where we launch the videos and the fact sheet. I would like to invite you to take these videos, this fact sheet, and use them for your families. And I would like to show you the videos to you, these 4 ones that are available, to give you an idea of how happy and warm they are, and how can we can hope they can be inspiration to parents everywhere. The videos are very short, they're only 45 seconds long, so I will show them in a sequence, one after the others. Unfortunately, the platform, it has a problem with the audio, so you will not hear the audio, but that's not a big problem, because the videos are made not to have words. The audio is nice, it has nice music, and you can hear the voices of the family, but not real word. So it's not the same without the audio, but it still works. And if you give me 1 second, I will try to, oh, now I've lost it, to play the videos. I hope I'm back at the presentation, and I hope you liked the videos and you see the potential in them. If a parent does at least one of those things a day or a week, and changes the way their way of being a parent just a little bit warmer, already that can make an enormous difference. And I hope in the discussion we can discuss some ideas on how to use these tools, or maybe other ideas that you might have to reach parents in these difficult times and help them be better parents. Because really, remember the report of Save the Children. All of those children that are experiencing high rates of domestic abuse in the family, those are children at risk. And really acting now, we are talking about protecting a future generation and in its entirety. So let us join forces for the self-and development of children. And I'm really looking forward to collaborate together, of course, especially in these difficult times, but also in the future in general. Thank you very much. These are all of my details, where you can find me and our materials that I invite you to use to the maximum possible effect. Thank you. Over and done.
Hello.
Hi.
Okay. Thank you so much, Giovanna, for a wonderful presentation. Wow, it has been very good. It has been very inspiring and very educative, particularly as people who are working with families and working with children. I liked some of the comments which have been coming through, but also the observations myself. Are you hearing me? And also the observations which have been made. I like the word, when you talk about parents, I like the word warmth.
Yes.
Warmth learning lifestyle. I like that word. And I like some of the tools you have developed which talk about warmth lifestyle. I like the word which came through your discussion, affectionate layering, affectioning and attachment. I liked bonding. When you say we need to bond with our children, when we go to work with families, we need to teach them how to bond with their children. For me, that is very, very positive. But also the last two issues you have shared about the tools which have been developed at UNODC are very helpful. And I want to encourage many of our colleagues, particularly in low resource setting, Uganda and other countries, to take advantage of the website, to the UNODC website, and download those tools and use them to reach many families, to support many families and help them. My colleagues, take advantage, visit the UNODC tool, United Nations Office of Drug and Crime, and get all these tools on parenting lifestyles, the new projects, the listening in, and many other tools. We thank you so much. We appreciate on behalf of the Uganda chapter. But also, I think I need to open up for one or two questions. Maybe people can add one or two ideas on parenting lifestyles. But also, if they have any other question, they can ask. I'm going to request them to raise their hands, and we can ask them to speak, and you can respond in 1 or 2 minutes, because time is not on our side. Thank you so much. But again, thank you so much for the wonderful presentation.
My pleasure, dear. Let's see if people have questions or ideas.
Okay, online here, we can see some people raise some questions.
Okay, I don't see them. So if you tell me,
you one, but if you have access to the,
I don't, or at least
I can leave you one. Of
Yes.
course, people, we have one Margaret Julius from, is it from Nigeria? She's saying, how can I apply this in my country, Nigeria? Another one is, another one is, again, Margaret also is interested. How can I be connected? I would love to connect to your impact, please. And what will be the advice? Of course, we've got regional offices in Nigeria and in Nairobi, but we're asking, how do we contact so that we get more information so that we can apply some of these good practices which have been found to be working and some of these tools? I think, largely, those are the questions. Do we have another one? Let's see the last one before we give you to make your final remarks. I think most of the comments which have been coming, really, they have been appreciating your presentation, they are appreciating your preparation and the way you have articulated the issues, how to work with families in this, you know, if there is a substance abuse, but generally, and I imagine that the knowledge can be used even to address other issues in a family, not necessarily substance abuse, violence, and many other issues which you can comment about. It. But most of them are appreciating. Thank you so much. I'm going to give you more 2-3 minutes to do a wrap up and respond to the questions. And thank you so much for the time. I know it's so early. Thank you so much for waking up early to come and do the presentation.
No, it's not.
Thank you.
No, it's not so
okay,
early.
Giovanna, through now.
My daughter wakes me up much earlier, I can tell you. Talk about parenting skills. Waking up early is a very important parenting skill. So so basically well, thank you for the appreciation. I'm glad that you find at least some of this useful or inspiring, and please let us talk, be in contact more in the future. Now, how to use this in practice? There are various ways that I can think about, and I'm just presenting them to you. In some countries, we have offices. You were mentioning Nigeria. So if you get in contact with me, I can easily put you in contact with our office there. And there might be opportunities to work on this kind of prevention with our office. You never know. Uganda is unfortunately not a place where we have an office. We have the office in Nairobi, but of course it's not the same thing, right? But I can, of course, put you in contact with Nairobi as well, and there might be possibilities there. Another thing is, please keep an eye on our Twitter, because at least once a year we publicize an opportunity for small grants. The grants are small, they don't arrive very quickly, but they are an opportunity for community-based organization to, you know, try some new prevention. And if you apply, please let me know so that we can help you build a strong application and maximize your chances of getting the grants and working with us for implementing evidence-based prevention, which could be family skills. I was thinking immediately, of course, about money, but there are very different ways in which we can you can take these materials and use them. Certainly, as Rogers was saying, please take advantage of going to the website and look at the material and think about how this can be disseminated among the parents. There might be some printing, but there are places where organizations have organized a chain of parents so that parents get in contact with each other and talk maybe on the phone or in a socially distanced way about the different tips on how to, you know, cope with this difficult situation in general. And it could be the pandemic, but it could also be outside of the pandemic. We have been working on this way before the pandemic. So these are certainly ideas. if you are interested in actually implementing the program, I would say by all means get in contact with us, because we know who are the good trainers. We can put you in contact with them. Maybe there is another training somewhere else and you can attend remotely, because it is important that you learn how to use the program well. They're not complicated, but some training is interesting and necessary. And if you go to our Twitter account, you will find also the link to our publication page, where there are all of the publication on the family programs that I mentioned in this presentation. So you can already start documenting yourself there. And if you're interested, by all means, let's get in contact. And finally, of course, I would add, don't get in contact with me only. Get in contact with your fellow colleagues in ISSUP Uganda, in ISSUP Africa, in ISSUP International. That's what the network is for. And there are many people all around the world that are thinking and trying to address the same problems as you are. And maybe you can learn from each other. Maybe they can give you ideas. Maybe they are organizing a training and you can join remotely. So that is the power of ISSUP. Not only that they organize these opportunities for to learn about what is a good prevention, a good treatment, and so on, but above all, that they put you in contact with other people that also want to learn about good prevention and treatment, and you can help each other and really make a change. So I would certainly encourage you to use the network. And then again, maybe an idea comes up in the network to organize something, some more training, and we are certainly at your disposal, time permitting, of course, to help you in any way possible. So there are many ideas. I have shared in the presentation our guide, which is in our publication page. And if you are concerned about how to organize these family programs from the practical point of view, because sometimes it is difficult to get the parents, right? That guide is full of tips and advice from or developers of the programs that have implemented this program all around the world, and so there are all the detailed steps of implementation on how to make this program a success also in your countries. So there are already many resources to study. I have pointed you in the presentation. You find the most important ones. So maybe start from there. And if you're still confused and lost, as I said, reach out to your fellow colleagues on ISSUP, reach out to me. I'm sure we can collectively find a solution.
Okay, thank you so much, Giovanna, for that wonderful presentation and the feedback we have got from you. We appreciate the time. We appreciate all the information you have shared. We also appreciate ISSUP, which has given us information about, which has helped us to reach and contact some of you. And like you have said, ISSUP Uganda is organizing a series of webinars to touch on many areas which affect young people and even adults. We will be doing more. We'll be doing more, and we appreciate. Thank you so much for the time. I'll make a few announcements. If some of you get off, don't mind. I'll make a few announcements for our Ugandan chapter in 1 or 2 seconds. But thank you so much. The rest can get off or can listen for a sec. One is that we are planning to organize training in UPC and UTC around February or March next year. Please, those who are interested, get in touch with ISSUP chapter, Andrew and Barbara, and we can see who are interested and we can train. We are also looking for training for schools, for school teachers. We are planning that also around March. We want to get in touch with teachers and schools so that they can create an environment which can prevent substance abuse. But I also want to remind our NGOs, please register for the Vienna NGO and become a member for the Vienna NGO community, which represents us and which is a platform for us NGOs, so that we can be in touch, we can hear, and we can learn a lot. And lastly is to appreciate you members, to appreciate ISSUP, to appreciate Giovanna and the team for the wonderful work you have made. Thank you so much, and see you next time. Thank you so much. Bye-bye. Thank you so much, Olivia, Michael, Jeff, and others. Bye-bye.